It's around 40 grams of protein only. So what's the harm on it? How it's going to affect the kidney? I'm very surprised with some of my colleagues, which they're just talking nonsense without proving something, document. And it's documented, unfortunately. Okay, so even carb ice cream is okay. Now, while there is a significant decrease in the diet, it's going to gain weight, no matter whatever you do. Now, this recent studies, treatment of type 2 diabetes in childhood. This is recently in Diabetic Care, 2004. Ketogenic diet has a very high potential as an alternative to pharmacological therapies. And they did a beautiful study. It's published recently. Recent studies. Now, see how it's important. Dietary carbohydrate and breast risk and breast cancer risk. A prospective study of this rule of overall glycemic index and glycemic load. Consumption of diet with high glycemic index, which from imagine, this which was the amount of fat and carbohydrate was almost the same. When they decreased the amount of fat, the weight started shooting up. And this is again the studies from the which shows that 7.5 and after 24 weeks become 77. Now, this is a very interesting study. Teenager who followed a low carbohydrate diet lost more weight than teenager who followed a low fat diet, and was number of 30 cases, 12-week studies, and this was on low fat. This divided, and they lost ketogenic diet subject lost 8.5 kilogram over 6 months compared to only 4.5 kilograms. HDL decreased. Of course, there was no significant after. But imagine about HDL, which is important for us, high-density lipoprotein. It's very important. And that's one which sweeps and goes and removes the LDL, the particle which is really accumulates on the vessels wall. So 8.8%. The ratio of cholesterol to high-density lipoprotein, 16%. And imagine triglyceride level, which there is no single drug which can decrease triglyceride, affecting the lean body. Without affecting lean body. This is Annal of Internal Medicine. Of course, old paper, 1965. And related of the risk of diabetes according to the body mass index. Of course, whenever body mass index increases, the risk factors are increasing. The one who are above 35, within 5 years, they are more prone to develop 50% the risk factor, getting all sorts of diseases. This is again pounds of body fat lost per week on varying gram of carbohydrate intake. If it's 104, they lose around 2 pounds. If it's cholesterol levels, triglyceride level, HDL, LDL, all are improved. And here, the high-fat control carb approach improved lipid profile. This is another study, is not related to our study, but the result almost, I can show you the difference later on. The weight around 18% within 12 months. Total cholesterol, 28%, imagine, without taking any drugs. And we know all statin type of drug, what can do for human being at the long run. I'm sure all of us, we know the side effect of it. Unfortunately, we go just to fool ourselves and fool patients. Triglyceride, 32%. High-density lipoprotein, imagine, 30% improves in high-density lipoprotein. Low density, 35%. Very low density, 20%. Now, conditions that need guidance. Really, kidney disease, of course, protein intake must be monitored in renal patients. We have to monitor, no doubt. Diabetic, we have to really collaborate with the doctor specialist and to see the patient's conditions. And gout, of course. Pregnant and breastfeeding, of course, regarding the program, dieting, weight loss are not recommended during pregnancy and breastfeeding mother, and not even for the patient who are 12 years old. Now, it's quite evident that high carbohydrate diet increases fasting plasma triglyceride concentration. It's well proven. There is no way to tell you. There is a lot of literature. Nowadays, they said all the heart diseases, heart problem, congestive heart failure, because of we are consuming high amount of carbohydrate. Full stop. No one can argue no. Yes, it does. Now, it decreases, not only that, it decreases high-density lipoprotein, which is a beautiful cholesterol, is helping us. We are throwing it out. And these changes associated with atherogenesis. Now, some of my colleagues, they are describing some anti-obesity drug, and this is another harmful drugs. Believe me, it's worse. Whenever I go and read, I feel so upset. Imagine, there are 5 drugs were removed from United States because of its safety concerns. These are phenfluramine, dexphenfluramine, and phenylpropanolamine internationally, and diethylpropoin and phentermine were taken from in Europe. Now, use of a weight loss drug, when they used this drug for 12 months, resulted only in 1.1 pound loss. Only. Imagine. Using for 12 months, certain drugs didn't help patient. It's again, this is latest paper, huh? It's obesity management, anal internal medicine. It's not from the Dashti's house, huh? It's from the internal medicine, yes. Now, let us go to each drug and say, sibutramine, Redactyl, another horrible drug. See, this is a study done, 4.4 kg to 12, for 12 months. They lose only 4 or 5 kg, say. And what is the side effects? Increase in blood pressure, imagine. You are treating somewhere, and you are increasing blood pressure and pulse. Orlistat, another horrible drug, Xenical. Huh? Nervousness. See, phentermine, diarrhea, flatulence, bloating, all sorts of drugs causing. Not good. It stimulates the nervous system. It stimulates the smallest nerve fiber in our body. It's really destroy it. And there was a study in Johns Hopkins indicating that it causes, in the long term, effect on the small nerve fibers and loss of memory.